Preterm pre-labor rupture of membrane. This is the condition which is characterized by leakage of amniotic fluid in absence of uterine activity. Now, baby is or the fetus is surrounded with amniotic fluid and amniotic membrane, and when there is leakage of amniotic fluid occurs, so that condition is characterized by preterm pre-labor rupture of membrane. And in this condition, what happens when amniotic fluid is leaked out and the baby will have no environment, safe environment to live, so this that can create problems. And this is dangerous condition occurs in between 24 to 36 weeks of the gestation. Now the risk factors are the ascending infection from the lower genital tract can be dangerous, and multiple pregnancies. Those women who have given multiple pregnancies with the same disease can develop this condition. Polyhydramnios, antepartum hemorrhage, placental abruption, cervical weakness, and idiopathic causes can be there. So in this way, this condition can develop. Diagnosis of the preterm pre-labor rupture of the membrane occurs. Sudden gush of copious vaginal fluid comes out, and that will indicate that this condition. Pool of amniotic fluid occurs in the posterior vaginal cervix on the speculum. Oligohydramnios is also seen in ultrasound because a lot of amniotic fluid is lost from the baby, from the amniotic membrane because of that rupture of the membrane. So oligohydramnios occurs. Differential diagnosis will be urinary incontinence, urinary tract infection, vaginal infection, and leukocoria. So these are the differentials, and diagnostic criteria will be pooling positive amniotic fluid in the posterior vaginal cervix will give indication. Fern positive microscopy will show infection because most common cause of this condition is ascending infection of the bacteria. And nitrazine positive, it is a test which is done to diagnose preterm pre-labor rupture of membrane. Management will be gestational age calculation and chorioamnionitis estimation. So on this basis we can manage. In chorioamnionitis, history of the patient will be taken. So patient will complain of the fever, abdominal pain, purulent offensive vaginal discharge. On examination, uterus will be tender and confirmed rupture of the membrane will be there, and absence of UTI will be there. So preterm pre-labor rupture of the membrane can be managed by corticosteroid administration and antibiotic administration. Tocolytics are contraindicated due to increased risk of maternal and fetal infection in presence of preterm pre-labor rupture of membrane. Gestational age should be managed. If the gestational age is less than 34, so there should be conservative management, because if in this time period less than 34 week a baby is given birth, that baby will be preterm, and preterm baby can develop a lot of complications. So this thing should be managed conservatively. In this way we can manage. Hospitalize the patient, administer corticosteroid for 7 days, antibiotics, and obtain cervical culture. And group B streptococcal in prophylaxis treatment should be given. Gestational age is if greater than 34, then amniotic fluid test is done and prophylactic course of the antibiotics is started. So in this way we can manage the patient of preterm pre-labor rupture of membrane.